It gives me great privilege to welcome you to the fourth snippet of Anatomy Snippet series, wherein we'll be discussing the MCQs of the topic brainstem syndromes, which I have covered in the snippet number 3. So following the same MCQ reading technique that we have been doing in our previous snippets. Okay, so this is the MCQ number 1. I request everyone to read the question along with me the way I am reading, and then pause the video, try to answer it yourself, and then check the answer. I think anyone, if they want to check how is their comprehension, because we all are students, so we should be first reading a topic or seeing a video. After that, we should solve some MCQs and see that how many MCQs we are getting it correct. More important is actually to review those MCQs. So moving on to question number 1. Ischemia involving which of the following vessels is most likely present in this patient? A. Anterior cerebral artery. B. Posterior cerebral artery. C. Basilar artery. D. Anterior spinal artery. So looking at the options, not even reading the question, I get to know that, oh, all are arteries of the brain. And yes, so this question can either be an anatomy question or a question from stroke or a question from brainstem syndromes. Fourth possibility is very less likely. So now really looking at the keywords, like I told you that I want to see the keywords of the question. So keyword here is tremor. Okay. And if you remember that I have discussed in Benedict syndrome, why there is tremor occurring. There is tremor occurring due to involvement of or damage to the red nucleus. Because there is damage to the red nucleus, there is tremor which is occurring. The second keyword is ptosis, abduction, involuntary movements. These involuntary movements are actually hemibalismus. That also we have discussed. Hemibalismus occurring in Benedict syndrome. So this clinical vignette is of Benedict syndrome. And if you remember, Benedict syndrome is due to involvement of the posterior cerebral artery. The posterior cerebral artery. So answer is B, posterior cerebral artery. Moving on to question number 2. MRI in this boy is most likely to show an abnormality in which of the following structures? A. Medulla, B. Pons, C. Basal ganglia, D. Pineal gland. Okay, so all options are basically parts of brain, or yeah, parts of brain only. So the keyword here is pupillary light near dissociation is present. So pupillary light near dissociation, if you remember, this is starting with the word P, pretectal nucleus starting with the word P, Perinod syndrome starting with the word P. So this is a clinical vignette of Perinod syndrome. Most common cause of a Perinod syndrome is a pinealoma, that is tumor of the pineal gland. That's why the answer is D, pineal gland. Moving on to MCQ number 3, which is of a slightly higher level than the previous two MCQs. On examination, uvula is deviated to the left side. Identify the correct side and artery involved in this woman's brainstem stroke. A. Left comma basilar, B. Right comma anterior spinal, C. Right comma anterior inferior cerebellar, D. Right comma posterior inferior cerebellar. So in the question only they have asked woman's stroke. So they have given this is a question of stroke, but I would like to specify it even further. Basilar, anterior spinal, anterior inferior cerebellar, posterior inferior cerebellar. They are all involved in brainstem syndrome strokes. So posterior inferior cerebellar is involved in lateral medullary, anterior spinal is involved in medial medullary, basilar are mostly involved in midbrain syndromes, right? So this is a question specifically of brainstem syndrome stroke. Now let me tell you what are the keywords. The keywords here are change in her voice. This can occur due to involvement of the muscles of the larynx, pharynx, mainly larynx, right? So ninth cranial nerve, glossopharyngeal nerve. Which syndrome involves ninth cranial nerve? The lateral medullary syndrome. Then gag reflex is absent. Again, which cranial nerves? Ninth and 10th cranial nerve. So again, lateral medullary syndrome. And uvula is deviated to contralateral side in lateral medullary, that we know. So the side is right side, correct? And Inability to swallow, again 9/10 cranial nerves. So because of all these things, it is lateral medullary syndrome. Uvula deviated on the contralateral side in lateral medullary. So because it is deviated in the left side in the question, the answer is right. Because it is lateral medullary, also called as Wallenberg syndrome, the artery involved is posterior inferior cerebellar artery, which supplies area behind the inferior olivary nucleus. Okay, so the answer is D, right, comma posterior inferior cerebellar. I hope you found these MCQ discussions apt. If you have any comments, please mail us on our official email ID, that is bvideomcquizingsociety@gmail.com. Thank you.